just reading from the internet. And what does it mean? It means that, real simple here, that people by the year 2014 are going to have to buy health insurance. So they will have to pay a penalty tax that you will be taxed upon if you don't buy individual health insurance or for your family for that matter. Now, how does that affect us as a company? Well, here's the good news. Folks, a lot of you here on this call today, people are going to have to buy, by law, by the year 2014, health insurance. And the nice thing about this is that it affects even low-cost plans and association plans according to Congress. Now, the full gamut of all the explanations of what's the minimum requirements, what's not, will be spelled out over the next 2 years before the individual man. I would imagine that by the next 12 months, not the next 2 years, we'll have a full written explanation on the government's website and from all the insurance carriers of what the minimum requirements are. Now, one of the good news for us is, folks, is now that we know that people are going to have some health care, those of you on this phone call here, some of you may actually become multimillionaires because of this, and here's why. If everyone is required, those of you right now you can go to companies and individuals who don't have health insurance and say, look, the law just passed. By 2014, if you want to wait to 2014, it's up to you. But right now, you should pick a health care plan, okay, to put in place before rates start going higher, because rates will go up. They're going up already, but now that everybody has to have it, and insurance companies have to insure people who are healthy and not healthy, I guarantee you the premiums will be going up. More and more people will not be able to afford traditional insurance. So you will see more people qualifying for Medicaid. Unfortunately, there's not a lot of money in Medicaid. And there was one law that got passed in Texas, for example, this year, that anybody on Medicaid will be limited to 10 days of hospitalization per year per family member. That's not good. So as more and more people qualify, there'll be less and less funds that go into it. So we don't know what's going to happen with that. But the bottom line is this. People are going to have the health care plan. What's good about that for all of us is a lot of you today, this is a good day for us as a future, because now we have a reason to continue to talk to people about health care plans, and we have affordable health care plans. So those of you here today, a lot of you who can get an insurance license over the next 2 years, we don't know what's going to happen as far as what other plans will become available. I would also basically, advise a lot of you, if you get a chance, go get your insurance license. You don't need it for our plans, but because we don't know what the future holds as far as other plans, the government may say, here's some new plans. And so we, as a company, are positioned with our insurance agency in case different things get implemented. We are positioned perfectly to take advantage of that. So that's a great advantage for us as we've been around for 29 years. But the nice thing is this, folks, is now that we know that, we got 2 years to prepare for this, for 2014, to gear up and help people. So that's 2 years of a lot of increased business for us now that the law got passed. But now this is good news, because we have 2 years now to continue to educate people and teach them and say, look, the law just passed, you're going to need a health care plan. Now, the health care plans today won't be mandated 2014, but you have a choice. Buy major medical insurance at the high prices it is, $1,200 to $1,500 a month for a family, anywhere from $400 to $700 or $800 a month for a single person. Just for me, for a low deductible, it's like $821 a month. So a lot of people still will not be able to afford comprehensive major medical insurance, though it's still guaranteed issue. Under this new law, it's going to be difficult for a lot of people to afford that. So what does that mean for us? That means increased business. We will have now more clients who will now listen to us a lot more because of this individual law. So I'm happy because there's going to mean a lot more business for all of us. So those of you that take this serious now, it still means that you still need to get educated, folks. You still need to get trained on the differences between comprehensive major medical and the limited insurance benefits we offer. It's real simple, folks. When I talk to people about, healthcare, they have questions. I always say, okay, major medical insurance, Kaiser, Blue Cross Blue Shield, United Care, Humana, Prudential, Cigna. There's so many major medical insurance carriers. If you take a look at a typical insurance plans. You can get free quotes online. You're going to see that it's anywhere between $1,100 to $1,600 a month per family for the lowest deductible, depending on the age. The younger the family, the less cost is going to be. The older the family, the more cost. And you may even get something at $900 to $800 for a family if they're very young, in their late 20s, early 30s. But as they get older, it's going to be well over $1,000 a month. As far as individuals, major medical insurance is expensive. It can be anywhere from $390 to $350 for a young person, $400, or up to $800 for an older person to get major medical insurance. So one of the things we need to educate is to share and educate with people the real cost of traditional insurance, and it still includes co-pays, it still includes deductibles, it still includes co-insurance, so that no matter what they're paying for major medical, there is no major medical, even with the new law, that's going to cover 100% of their medical bills. They're still going to have out-of-pocket costs. So as we explain our limited insurance benefits, from plans that cost $59 to $109 to $229 to $585, our benefits are limited, but you know what? It still qualifies for health insurance. It still will give them coverage under the individual mandate until any new laws have been changed. For now, it covers people. For now, it counts. So it's considered credible coverage for people who need it. Now, those laws can change. They may even have plans that are even less costly than us that can qualify. The nice thing about us, folks, is we are positioned as a company with 29 years with 5 full-time attorneys and a regulatory attorney on the outside. We have all the materials, we have all the laws, we have all the different things in place. Probably continue to talk about healthcare reform in all of our meetings now that the law has been passed by the Supreme Court. Just something small. We're not going to go to political debates. We're not going to go, whether you're Democrat or Republican. That doesn't matter. The law is passed. What we're going to discuss is what the law means for all of us and how it can affect us as a company and as civilians who live in this country, as people who are concerned about what does the law mean for us, okay? But basically what it means, folks, is that until 2014, everyone in this country will have to buy a health insurance plan or pay a tax. So what does that mean? That means that, these taxes that they're talking about, okay, will start small and eventually increase. It's good news for us as a company because now we have the news up there and all the papers and all the internet and all the televisions in English and Spanish and in every language. People will now know after today's decision that they're going to have to purchase a health insurance plan by the year 2014 and the individual mandate, which is passed as constitutional as a tax for people who don't have health insurance. So for us, again, that's good news for us as a company because more and more people now know they have to buy something. The Healthcare Reform Act states by the year 2018 that 30 million Americans still will be without any healthcare coverage. Still a huge block of business for us in this country. So good news for us all, for the company, with today's ruling from the Supreme Court, as more people now will have to make a choice and get something. Put some information on your Facebooks to discuss with people how the information is now coming to people about the Supreme Court decision today. Use your Facebooks, use your emails about today. Pass the word out about the decision that was made. This is how we do internet marketing for free. Use your Facebook, use your emails, use my blog, use my videos. There's a new video I'm going to have pretty soon discussing about individual mandate. That's going to be something hot because now, in addition to the dental, we now have a bigger reason now to discuss the medical plans that we have, the plans with the health insurance benefits, because they are health insurance benefits. They have discounts and insurance. They have policy numbers on the back of the group policies. So these are insurance benefits. It's not major medical, but it still is insurance benefits. So we're going to show up how the healthcare reform affects us with the individual mandate that was now passed into law, and how people can actually use our plans to offset the high cost of major medical to use it for small. I just had a phone call yesterday from a gentleman who is opting out of the major medical from his job because the rate increases, they can't afford it. Just can't afford it. Called me up to say, hey, Willie, I like that dental and medical plan you have, because now I really need the medical benefit stuff. I can't afford the ones for my job. And for my wife and 2 kids, we're all healthy. We're now, him and his wife are in their early 30s. The kids, I think, like 8 or 7 years old for both his children. So all healthy, no medication. So he says, I'm paying so much for major medical, we don't even use it. I don't want to go without it, but I can't afford it. But I need something. So he called me up the other day, 2 days ago, to ask, I like that dental and I like the medical. What do you recommend? And I said, well, what do you want? How much you want to spend? He says, well, as much as I want hospitalization, I don't think we need it now as young as we are, something I may add later. But I do want something for doctor visits, for the discount doctor visits, and for the $50 doctor reimbursement. He says, I do want the dental insurance. I want the lab work because I want to be able to, in case my kids need vaccinations and we need blood work, I want that. I also want something to, the prescription medications, the discount card is okay. I don't need the other one. And I do want to take lab tests and x-ray. So he told me what he wanted, and I was able to go over 3 or 4 of the plans with the medical benefits and dental, and actually make a good decision. I said, okay, you're already a member with the dental. Now all you got to do is take what I just gave you, call customer service, tell them exactly what I said, and tell them the plans that you want and the add-ons that you want, okay? And that's how simple that is. So you're going to see more and more people now, folks, calling you, talking to you. This is the perfect time for people to now join our company for the future, because now we have even a brighter future than before. I believe that people today will get involved with our company because of the decision made by the Supreme Court today, will truly have a chance to become multi-millionaires with us because of the decision that was made today. It is a truly bright day for our future of our company because of that decision today. Folks, it doesn't matter, again, whether you're for the law or against the law. It is now old arguments. Whether you're for it or against it, the law is the law, and we have to basically obey the laws. So the law's passed. What we need to do is how does that affect you for the future of this company? It is a bright future, folks. So I hope everybody, please share this information today. If you can get your people on the call, you want them to hear this information. Again, it was too soon to get them on the call today. Make sure that everybody in your team, email everyone, talk to people, get them on that call because you want everybody to hear this, the information of how it affects us. It is good news for us as a company. It is good news for us as IMAs. I'm not saying that everybody's happy about the laws, but it is the law now, and we all have to obey the laws. But as a company, it is great news for us because now people know they have to buy a plan. You're going to see a lot of people in your team upgrading to take the dental and the medical. And by the year 2014, wow, it's going to be a banner year, folks. Our future is getting bigger and bigger. We're increasing sales on a monthly basis, on a weekly basis, monthly basis. This is just going to add to the success we're having over the last couple of years. So I'm really excited about what just happened today as far as what it means for us as a company. So those of you out here, continue to spread the word. Continue to spread the word to people who need an opportunity, because now with this healthcare law, this now becomes the #1 opportunity in the country today. This is history that was made today from the Supreme Court. No other company, no other direct selling company, no other network marketing company is in a position to take advantage like we are of the news that was just passed today from the Supreme Court with a history-making decision. So those of you that are in the business that are new, that have been with us for a while, I hope you share my excitement and enthusiasm as far as the opportunity, okay? Whether you like the law or don't like the law, that's not open for discussion anymore. It is the law. So with that, I hope everybody understands the history-making news today and how it affects our company. I am really excited and happy that a lot of you have stood with us, have been patient with us. And, it's a challenge, folks. Any business is hard to do, whether it's healthcare, whether it's vitamins, whether it's water filter, no matter what business you do, you're always going to face a challenge where some people are going to want it, some people are not, some people buy it, some people cancel. That's in every business. Okay, so every business has challenges, but I don't see anything that has the potential windfall for us income-wise that we now have, especially with the decision today passed by the Supreme Court. So the opportunity's been brighter than before. I think Gil Dia always talks about the future being so bright that he needs a pair of sunglasses. I think he's going to need double sunglasses now, because now the future's doubly bright for us in helping people in this country understand what the law means for them and how we as a company can help them, not just with dental. We can now help them with the medical and the health insurance benefits.